We're in Lab 11 Skeletal 2. So in this lab, we're going to study the appendicular bones. And first, we start from the pectoral girdle. So we have the clavicle, and you have the acromial end, sternal end. That's the long bone. And in the scapular part, we in the class we talk about the fossa. We have different kind of fossa. We have the supraspinous fossa, infraspinous fossa, and subscapular fossa. And these are where the muscle goes through. And that's the spine area. And this one is called the acromion. The humerus, let's look at the humerus. Humerus, you have two neck. This one called anatomical neck, this one called the surgical neck. I got this picture from Wikipedia. What's the difference? Anatomical neck is where if you cut it, you found the epiphyseal line is inside. So that's where your epiphyseal line is located. That's why it's called an anatomical neck, because the anatomical landmark. Surgical neck. Surgical neck is you found the humerus, smaller become bigger. And when people fall, they will naturally put their hand out, and all the physical force will go through their hand to the humerus, and from the small area to the big area, and they break here. So the surgical neck is actually the area the surgeon have to fix it. So they call it the surgical neck. So there's a difference of these two necks. The radius, ulnar, okay, these two. Ulnar is a little bit longer. The ulnar is the one connect to the humerus. So this area called olecranon, and also called the olecranon process. Both of them are correct. In Lab 1, you learned the olecranon is actually the elbow, because it creates the elbow. It connects to the humerus. So the ulnar is a little bit longer than the radius. And the radius connect to the wrist. So there's a styloid process that's here, connect to the wrist. And the others are there. If I did not talk about the detail, you know the name. If I talk about the detail, you have to know the detail structure. Okay, let's look at the coxal bone. The coxal bone are made of three: the ilium, the pubis, and ischemium. So these three. And the connecting part is called the pubic symphysis. So it uses the fibrous cartilage, the very tough cartilage, connect them together. And here are your the leg bones. Okay, now let's look at the joint. So this is in your bone lecture 3, the joint. So between bone and bone, we call it joint. And the joint is designed for a movement, especially the synovial joint. That's the one give you the maximum movement, and it give you the maximum flexibility. The trait is stability. So it turns out your knee, your elbow, your shoulder is very, very unstable, because that's the joint give you the maximum flexibility. So they have a lot of structure there to prevent the damage, take the pressure, a lot of duct tape, so a lot of ligaments there. And you also have the pad to take the pressure, the meniscus. So let's look at those structure. So that's your knee. That's your knee from the outside view. And you have a lot of ligaments. Like you have the fibular collateral ligaments, you have tibia collateral ligaments. And let's look at the inside. You have two cruciate ligaments. The one from the anterior view is called the anterior cruciate ligament. And this one is called the posterior cruciate ligament. So these two, they can easily be damaged, especially the anterior cruciate ligament. That's the number one ligament been damaged in the athletes. And you have two collateral ligaments. You have the medial collateral ligaments and lateral collateral ligaments. To identify these two, you actually have to know this is the right leg of the left leg. And it's easy because the tibia is much bigger than the fibula, and fibula is in the lateral. So you know the one connect with the fibula is the lateral collateral ligaments. And the one connect with the tibia is the medial collateral ligaments. And these two are the meniscus. So you have the medial meniscus, lateral meniscus. These are the pad that take the pressure. Okay, that's it.